Jana Gregg is a 50-year-old female who presents today with chest pain that began 2 weeks ago. She describes the pain as a sharp stabbing pain that doesn't radiate anywhere, and they last for a couple minutes at a time. She's had 3 to 4 episodes since the first episode 2 weeks ago. She states that she also feels short of breath during these episodes, and she rates it as a 6 out of 10 on the pain scale, with no pain happening in between the episodes. She realized that these episodes happened when discussing her father's recent death or doing heavy physical activity like moving books, and she reports feeling on edge lately. She's not had a workup for these symptoms before, and she has a history of gestational hypertension. She's had 3 separate births with no pregnancy complications, and her last menstrual period was 1 year ago. She has no known allergies, and she doesn't take any medications regularly and does not have any active medical conditions. Otherwise, her past medical history is pretty unremarkable. She's up to date on all her vaccines. Her mom died of an MI at age 62, and her father died of a motor vehicle accident recently at age 78 and did not have any known heart disease. Her brother is age 62, and he has heart disease and had bypass in his 40s. Her sister is in her late 40s and does not have any heart disease, and she has not been told that she has heart disease yet. She's a guidance counselor, and she says that she's not been experiencing any extra stressors or hardships at work. She eats a normal American diet and doesn't exercise often. She has a glass of wine 3 to 4 nights a week to relax, and she does not use tobacco. The last time she used tobacco was 25 years ago. Otherwise, she denies any substance use. She drinks a sweet tea once a day, but otherwise doesn't use caffeine. In review of systems, she's been fatigued more lately, not sleeping well, but otherwise denies fever, chills, sweats, new cough, nausea, vomiting, diarrhea, and thoughts of harming herself or others. On physical exam, she's a slightly anxious appearing female who's sitting comfortably in the chair. Her BP is 150/96. Heart rate is 76, respiratory rate's 14, and temperature is 98.7. Her integrated skin exam and cardiac exam was normal. No murmurs, gallops, or rubs heard. Her lungs were clear to auscultation, and her abdominal exam was normal. And her peripheral pulses were 2+ bilaterally, no edema, swelling, or masses seen. So top 3 for her differential diagnosis. New onset anxiety panic disorder, especially with her father's recent death. Since these symptoms happen with discussing his death, we're thinking that this is more of an anxiety panic disorder. But we're also considering like a hyperthyroid disorder given her age, recent menopause, and the fact that she's female, because hyperthyroid can kind of mimic a panic disorder. So we want to rule that out to make sure that that doesn't get out of control. But we're also considering a type of cardiomyopathy, just given her extra stress and her previous history with hypertension and the current hypertension she's having in office today. We want to make sure she does not have any cardiomyopathy going on. So we want to do some labs on her, do CBC, BNP, troponin, thyroid, TSH with rebound T3, T4, lipid panel, A1C, HIV screening to rule out cardiac and endocrine causes. We also want to get an in-house EKG, make sure she doesn't have any red flags there. And if it comes back normal, maybe getting her on an SSRI today. And then we want her to follow up in 2 to 3 weeks with a referral to mental health in between and getting her some education from our office before she gets to the mental health experts. If her symptoms persist after the 2 to 3 weeks, we want to do a Holter monitor, maybe get an echo just to make sure that there's not anything else going on with arrhythmias or structural causes. We told her that if the symptoms get worse, to go to an ED, like if it goes down her arm or if it starts happening more often, and then to call us with any questions she has in between.